I did want to tell you, those of you who think that the end of the year is not a good time to look for a job, that is totally bogus as far as my experience and my clients are concerned. Even in 2001, after 9/11, the best month of the whole year for people in my group finding a job was December. And so the last quarter of the month has always been a good one. I don't know if it's because lots of companies have a fiscal year that is also the calendar year, and so they have money obligated that they have to spend. But do not let up on your job search during the holiday season. This is a really good time to go have informational interviews with people, renew your efforts on the jobs that are posted. It's a good time to make connections with people. Just a few of the people, of our people lately who've gone to work, I did find my list finally. Oh, and in my class, I have an interviewing class on Wednesdays. There were 6 people who showed up. 4 of them already have jobs. And they just were in my class because they had to, make their job search contacts. So all my classes count as job search contacts. So anyway, this one was Sarmista Dutta, who said, "Hope you're doing well. I thought I would let you know I got a job, started working from last week as a test engineer associate at Auto Traders. Thanks for helping me in my resume. I do really appreciate it." Next one, Trupti Samant. "I'm so happy to tell you that I got a job. The company is Nugistics. Same one I told you about. I'm so thankful to you for spending time and guiding me." She had spent the last 6 years at home as a stay-at-home mom and was able to come out and get another job in technology. So she's a QA person. Steve Neal, many of you know him from our classes, an attorney. He started work last Monday with Texas Workforce Commission as a mediation person. Pam Caldwell is going to start work at Apple December 1st as a training delivery manager. She was a very, very active Leap to Success volunteer. Hassam Dugman went to work as a case manager for a nonprofit. He came from Canada, where he had extensive case management and nonprofit experience, and he's gone to work. I don't know which one down here. Rendell Taylor has started his job as a software QA person with Qualitest, which does QA software QA for Whole Foods. Joanna DeLeon has started a new job with Google. She is also a Leap to Success volunteer. So lots of people are going to work, and many of them are going to work at some really, really good companies. Sean, yes?
3 companies to keep an eye on right now, because even though I am working, I still get phone calls about recruiter openings. HP, I've been in contact about them, so they're getting ready to ramp up something. Google is always getting ready to ramp up something. And Intel. I've been getting phone calls. Like I say, I'm working, I still get phone calls. I've been getting hammered by recruiting firms looking for those 3 places are looking for recruiters. So that means they're getting ready to start ramping up on So keep an eye on those 3 specifically.
Okay, great. So I hope you all heard that. HP, Intel.
What about PayPal? They seem to be, and Visa, they also seem to be busy here in Northland.
They are. Like I said, just those 3. When I start getting phone calls from they're looking for recruiters, that means they're going to be hiring a lot of positions. It's going to come up soon.
Okay, thank you very much for that. We also put out about 30 positions with WP Engine. They were doing a lot. That's WordPress. They have a whole building downtown. They're doing a lot of hiring. I can't remember who else I sent out there, but at any rate, there's tons of activity going on. So don't take a rest. This is a really good time. Tap into the Launchpad people who are working, see if they can help you. I think Visa is starting up. Visa is starting up, and to hire a lot of people. We do have Launchpad people who work there, and I don't understand exactly the connection here. I don't know if Sean knows this or not, but at the Workforce Center, we have some postings with Innovant, INOVANT. And when you look at the job description, it says we are a Visa company. So are they do you know what the relationship is between Innovant and Visa?
They may be kind of like a Ronstadt type of situation.
Okay. The salaries seem to be good. Are they,
Visa and PayPal are both in a competition to dominate the payments transaction market, which is about a $23 trillion global industry.
so are you,
Check Forbes magazine about a month ago, and it said the $23 trillion question, who will run it? And Visa, PayPal, and Google, and Amazon were the 4 big companies they mentioned that were all competing to dominate
And of course, they all have a presence here. PayPal, eBay is here, and we have Launchpad members who work there as well. So if you find something, then look on LinkedIn, see if we have a person. Look through our membership directory, see if people will be very willing to help you. So, all right, our speaker. We're going to have a two-part program today. And the first person who's going to speak is TJ Johnson. TJ has been a speaker here many times before. He is our insurance expert, and he is an expert on all things having to do with affordable health care. And since now is the re-enrollment period, he'll be able to sort of tell you how you access that. He's been able to come up with insurance programs for some of our people where they had to pay, I think one girl had to pay 15 cents a month. And she had a pre-existing condition. She'd been unemployed a long time. He's not always so successful. But he has a lot of good information that you'll want to hear about. So, are you ready? Are you wired? All right, let's give it up for TJ Johnson.
So a lot of you heard me talk before. My name is TJ Johnson. I'm a benefits specialist from C4 Benefits Group. I started talking here probably about 2 years ago when the ACA and Obamacare first started to roll out and started to get people ready for that. Fast forward to November 15th, 2014, open enrollment just started. So I'm coming back to kind of tell you about some of the new plans that are out and kind of some of the things that are going on with open enrollment and with the care and how to apply for some certain things and some subsidies and that sort of thing. So the new plans are out. They are a little bit pricier than Texas is one of the states where there's an increase. There were a few states that actually had a decrease. The good thing is there are more plans available. There are United Healthcare decided to play this year. They didn't really play in Austin last year. They have a very good network and that kind of thing. Kind of show of hands, do you want me to go all the way back to the beginning and explain how it's structured with the different types of plans, or do you want more of kind of an advanced view on this? Just kind of show of hands, do you want more of a basic understanding of bronze, silver, gold, platinum, or do we want to kind of fast forward and get more into the how to sign up and subsidy kind of deal? We'll cover the how to sign up and subsidy either way. It just depends on how much information you guys want me to throw at you today. More advanced? Less advanced? Okay. Okay. So show of hands. How many want kind of the basic type information first, and then we'll move forward from there. Okay. And how many want the more advanced? We'll get to the advanced stuff too. Don't worry about it. Okay. So we're leaning a little more towards more basic stuff. So we'll cover that real quick. Unfortunately, I don't have a slide for it. But basically, under the ACA, the main points to take away from the ACA is. The main points to take away from the ACA that changed a lot from pre-ACA is that there's pre-existing conditions no longer matter. So you can have any pre-existing condition you want. All companies still have to take you. Lifetime maximum limits were done away with. So most policies used to have $1 million lifetime limit or something like that. That's all gone right now. And one of the biggest changes that they did also was that you can now have children-only policies. It used to be in order to get a policy for your children, you had to have an adult policy and tack them on as your dependents. You can now have a children-only policy, which opens up different options for people that have kids and differing levels of coverage. Because it used to be that if you were 50 years old and you had young kids and you needed a really great plan for you, then you had to put your kids on the same really great plan and pay a whole lot of money for a plan that they may or may not use. Now that's all out the window, and you can change that all around. Have everybody have different plans, different deductibles, that kind of thing. The other thing that changed was there are more things included. There's 63 preventative benefits as well as a whole host of other benefits that are required by law, mandated by law to be included in all plans that are what's called ACA compliant. So most of the plans are expiring end of this year. There were some grandfathered plans that will run until September of next year. But by the end of next year, everyone will have to be off the pre-ACA plans. Everyone will have to be on an ACA compliant plan as part of the law. Big changes on maternity is now covered. It used to be in the state of Texas. There was only 2 states that I think that allowed it. If you had a private non-group plan, there was no way to get maternity covered right? You had to buy a separate maternity plan, and you had to buy it 12 months before you were pregnant, and all this other kind of stuff. That's now out the window. You can be 8.5 months pregnant and still get maternity coverage if you bought a plan today. So those are a lot of the big changes. The other changes is it used to be able to do it like your car insurance, where you could kind of slide the levers around and pick your deductible and pick your out-of-pocket maximum and pick your copay and that kind of stuff. It doesn't work that way anymore. The plans are written the way the plans are written, and you can't change anything in the parameters of any of those plans. The plans all fall under 4 categories. They fall under bronze, silver, gold, or platinum. The background behind that is when they built this plan, when they built the ACA, and the reason they named them that was because they said, well, everybody's familiar with the Olympic medals, and they know that silver's better than bronze and gold's better than silver. So if we name them metallic plans, everybody's going to know that the silver plan is better than the bronze plan, the gold plan is better than the silver plan, and the platinum is better than the gold. True story. That's really why they named them that. It has nothing to do with anything else. So what does all that mean? All the plan means is it's an actuarial value. Bronze is 60%. Silver 70, gold 80, and platinum 90. What does that mean? That means that the bronze plan is expected to cover 60% of your average person's out-of-pocket costs for medical care per year. What does that mean in reality? It doesn't mean anything. Because none of us are average, and average of what? Average of a 35-year-old non-smoking male who lives in Nebraska? Who knows, right? It doesn't really mean anything. Just know that the higher level of coverage, the more you're going to pay, but the better the coverage is going to be. Okay? That's all you really need to take away from the different tiers. If you have a plan that does not say bronze, silver, gold, or platinum, or if you get a phone call saying affordable health care, sign up with me now. Oh yeah, we're going to get you on XYZ plan. If it does not have bronze, silver, gold, or platinum in the name, it is not an ACA compliant plan. There's a lot of people hawking indemnity plans and fixed cost plans and discount plans and all this other kind of stuff saying, oh yeah, it's cheap affordable health care. And you hear the price and it's $135 and you say, yeah, that sounds great. If it's not an ACA compliant plan, it does not get you out of the mandate, which means it does not get you out of the fine, the tax penalty for not having coverage at the end of the year. So, tax penalty, what does that mean? If you do not have credible coverage, meaning an ACA compliant plan, for 9 months out of the year, you will get hit with a non-compliance tax penalty when you file your taxes for that year. So if you didn't have coverage this year, you're going to get hit when you file your taxes in January or February of next year. It's a percentage or a flat number. For this year, it was very, very low. It was $90 or 1% of your income, whichever is higher. Next year it goes to $695 or 2% of your income. On all subsequent years after that, it goes to 2.5% of your income or $895 per adult. Kids are less, but it's capped per family. So if you have 5 kids and you and your husband and none of you have coverage, it's not going to be all those numbers added up. It's capped at a certain price. Okay? It's levied as a tax penalty, which means at the end of the year you have to file, and it's leveled as if you're going to get a refund, they take the tax penalty out of your refund. If you're not going to get a refund, it's added on to your taxes owed. But you do not have to write a check. So say, for instance, you owe no taxes, but your tax penalty comes out to $695 because you're single and you didn't get health care, right? You do not have to write a check. It's simply levied against whatever you get moving forward. There's no late penalties and there's no interest attached to it. That's written into the law, right? I would not advise playing the game of, okay, well, I'm just not going to pay it, right? Or I'm just going to take the penalty. The IRS is going to get their money. They may wait until you're 62 and start drawing Social Security, and they will take that penalty out of your Social Security check. It's the IRS that's leveling that penalty. It's not Humana or United Healthcare or something like that. If you owe the IRS money, they're going to get it from you somehow. But they're not going to necessarily, you don't have to write a check for it right then and there. So a lot of people this year played the game. They said, well, $90 penalty, 1% of my income, it's cheaper to go uninsured. That's a decision that you have to make on your own. I don't advise that or disadvise that. That's up to you. So that's a little bit about the tax penalties and how the coverage works. Any group plan that you have counts as credible coverage. They all have to be compliant by this year, so it doesn't make any difference. COBRA counts as compliant coverage. Okay? So if you're under group or anything like that, you've all had compliant coverage. The very first talk I gave here was about COBRA. COBRA is not always your best option. There's a few small windows where it is. One of the things that I do, and I work with a lot of people in here, is I'm counseling them on whether COBRA is the best option or not. Sometimes it's situational, but sometimes the best option is you stay on coverage and you roll your family off onto private. That's up to you. That's something that we can talk about offline if you have questions about COBRA. So jumping in kind of into the middle here. So open enrollment started November 15th. This year it runs until February 15th. In subsequent years, it will be November 15th to January 15th. They extended it 1 month this year. Okay? So November 15th to February 15th. If you want January 1 effective coverage, you must have signed up by December 15th. By signing up, I mean that your policy is issued. You can't simply sign on to healthcare.gov, create an account, and go, okay, cool. That's what they did last year because there were so many issues getting into healthcare.gov. As far as I know, they have not extended that courtesy this year. So you can't just say, oh, well, I was in the process, but I got locked out of the system. I'm not going to sign up until December 31st. December 15th is the cutoff for January 1 effective coverage. It is not December 16th. The computer system will lock you into February 1. There's nothing that you can do on my end, on your end, on anybody's end. There's nobody to call. It's the way the program is written. It will default you. If you sign up December 16th, the computer program will default you to February 1 effective coverage. That's just the way it is. So, subsidies. Everybody wants to know about subsidies. These are base numbers. Okay? If you fall into one of these categories, you are most likely eligible for some sort of subsidy. Now, a quick thing about subsidies. The younger you are, the subsidy is based upon percentage of income. So if you're 21 years old and your policy is only going to cost you $160 anyway, as long as it falls into a certain percentage of your income, even though you think you're eligible for a subsidy, you're not going to get one. So if the upper limit is $45,000 for a single person, if you make less than $45,000, you're going to be eligible for the subsidy. And you're 25 years old and you're going to make $42,000, you're most likely not going to get a subsidy because the percentage of your income that policy costs is so low. If you're 55 years old and you're going to make $42,000, you're probably going to get a subsidy because your policy is much, much more expensive. So you can't just base it upon the numbers and go, yay, I'm going to get this huge subsidy. It's also based upon your age and the cost of the policy itself. The policies under the ACA can only be based on 4 things. They can be based on your age, they can be based on tobacco use, they can be based on geographic area, and they can be based upon number of people being insured. Those are the only 4 criteria that they can use to base your policy premium. That's part of the reason why, if you're older and your premium is more expensive, we get a larger subsidy for it. Does that make sense? So subsidies can be used 3 ways if you qualify for one. You can be used to offset the cost of your policy month to month. You can use a percentage of that subsidy to offset a percentage of your policy month to month. Or you can wait all the way till the end of the year and get it back as a tax credit. Say, I'll go ahead and pay the full premium month to month, and I'll take the money at the end, and I'll take the money as a tax credit at the end of the year. For you guys sitting in this room, this is a decision to make. Because as you guys all go back to work, your income is going to change. It's going to go back up, right? So what happens if I put down my income that I'm going to make $40,000 this year, I get a great subsidy, then 2 months from now I get a great job, I'm making $100,000 a year. You can simply go back in and change it. Okay? If for some reason you get subsidized at $300 a month for 11 months out of the year, and then in December you get a great job, and you get a sign-on bonus, and your income goes through the roof, right? Yes, the government wants part of that money back that they subsidized you. But again, it's prorated. So if you got $300 a month for 11 months and you got $3,300 in subsidy, you're not going to owe $3,300 in subsidy back. It's prorated on a certain amount and it's prorated per month. But yes, the government will want some of that money back. Again, it'll be levied as a tax penalty and not as write a check, you owe us this kind of money. I have Humana handouts. They're Humana branded. Don't think anything of that. Humana just sends me the most free stuff every year. It'll have this tax table, if I brought the right one. It'll have this tax table in it. So don't try, you don't need to write down all the numbers that are on there. So what counts as income, right? Yes, unemployment counts as income. Child support does not count as income. Any money that you're drawing off your retirement incomes, any Social Security, any money that the government is giving you counts as income. So there's two ways that you can do it. And again, for you guys, especially towards the end of the year here, a lot of you guys, when you come out of the tech industry, you get a bonus, or you get your vacation time, or you get some sort of severance package, which means that you actually made a whole lot of money this year, right? So you don't qualify for a subsidy rolling into this year, right? The other thing they do is, and I'll get into that towards the end, is they subsidize your COBRA, which makes it a little stickier. So there's a question on, when you go through healthcare.gov, it says, what was your income for last year, meaning 2014? And then the next question is, do you anticipate that your income will be the same next year? And you can either answer, the answer is either yes or no / I don't know. If you click on no, it will then ask you, what do you estimate your income is going to be, right? So that's where you can put in an estimated income, right? If you're drawing unemployment, you can estimate it on your unemployment. The assumption is that you guys are all going to get jobs and go back to work, right? But for right now, what you guys need to do is make sure that you can get the most bang for your buck, right? So what you can do is you can estimate, well, I'm going to be on unemployment all next year, right? I'm going to make $2,000, was it $1,800, $427 every week, right? Right. So it's roughly $1,800 a month. Times 12 is 21 something, 21.6 or something like that. I've done this a few times. What's that? Can't you? But you can file for an extension, can't you? There is an orange. Okay. So you can estimate it on that. But here's where you run into trouble. You can estimate it on that, and then when you get a job, you can change it, right? So get the subsidy now. When you get your job again, you can change it, and then you lose your subsidy. But chances are that if you're going to get a job where you make $100,000, $80,000 a year, they're going to offer you a group anyway, which is going to mean you're not eligible for a subsidy anyway, and you're going to roll on a group anyway. So you're automatically going to have to change it. Here's the black hole that you fall into. If you're single and you estimate under $11,490, it'll automatically say you're not eligible for a subsidy, you're eligible for Medicaid. The problem in Texas is they didn't expand the Medicaid ranks. So you send in the Medicaid paperwork, you wait 45 days, and they come back, you're not eligible for Medicaid. You're not eligible for a subsidy, and you're not eligible for Medicaid. So you're in a black hole, right? You can't do anything. So now you're stuck paying full price for your health care. So, say for instance you were going to be on unemployment for 6 months. And then at the end of that 6 months, because many of you like, supporting a family, or you got bills to pay, right? You would have to go out and get a survival job, correct? Somebody would have to go do something for 10, 12 bucks an hour, right? So now you're talking about estimating your income, which would put you over the threshold of 11.4, but low enough for you to get a subsidy. Remember, it's all based on estimates. Now what's going to happen is the government's going to kick back and they're going to say, we want verification. How do we know that you're just not playing the game and estimating your income just high enough so you can get 100% subsidy, but just low enough so you don't have to pay anything, right? So you send it, well, they're not going to ask for unemployment because they have records of that. If they want record of it, just send in your stub and say this is unemployment, right? Then when you get your survival job, you send in a pay stub showing that. There are situations with people that were unable to verify their income. Then you're going to get a letter saying we're going to terminate your policy. Then we have to work through that stage. Again, for most of you, what we're talking about, hopefully, is a 3 to 6 month period of being laid off, and then you're going to go back to being gainfully employed, right? This is a numbers game. All this is figuring out the numbers. Once you know the rules of the game, play by the rules, but play to win. Okay? So if you can estimate your income at $32,000 for a family of 4, you're going to get the maximum. Okay? Yes. There's a fine line between estimating your income as a family where you want it to be so your kids are eligible for CHIP and you as adults are still eligible for a subsidy. And that's a whole different set of numbers, but there is a fine line that you can walk to get your children into CHIP to get free health care and to get you guys a subsidy as best you can. Victoria?
I'm not sure if you had answered this as part of that, what you were just saying, but for those of us whose unemployment runs out like soon, and no clue at all what I might be making in 2015, like no clue. How do you even begin to make this special if you want verification?
So there's a grace period. You're gonna run about a 90-month and then you can 90-day, and then you can technically stall them for another 90 days, which takes you out to 180 days without actually submitting income verification. Okay? You didn't hear that from me. Technically, if we play the game and you play the system, they give you 90 days to submit. So there's probably going to be, anywhere from 30 to 60 days before you get the notice. Then they give you 90 days to submit it, and then theoretically, you could file and say, oh, well, I couldn't get it together, and they'll give you another 90 days. So theoretically, you could estimate your income as a survival job at such a number and play the game for a certain amount of time. Is it a perfect situation? No. Being unemployed is never a perfect situation. Having no income is never a perfect situation. There are ways to work the system as best you can, and that's the best answer, honestly, that I can give you on something like that.
Thank you.
Uh-huh. No. If you get a job and you're offered group insurance, there's two things you can do. You can keep your private plan, but you automatically lose your eligibility for subsidy. Even if the plan sucks, even if the group plan is the worst insurance that you've ever seen, the mere fact that it is offered to you means that you are no longer eligible for a subsidy. Likewise, if your spouse gets a job that has group coverage and you are eligible to be on that policy, you lose your ability to get a subsidy. The reason being is the government doesn't want to pay out any more dollars in subsidy as they possibly can. And so they say you're no longer eligible for a subsidy if you can get insurance somewhere else. And then, yes, what'll happen is, the best case scenario is you go on and tell care.gov and say, I got a job, cancel my policy. Worst case scenario is you don't. They're going to find out eventually and terminate your policy. So the question was, if you get group coverage, what happens to this policy? You're more than welcome to keep it if it's better coverage, but you will pay full price. There's no way around that. So again, what's covered? You see down here unemployment, dividends, alimony, any capital gains, anything that you're drawing out of your retirement accounts. That all counts as income. On the silver plan, the silver plan is the plan that all of this is based upon. The subsidy is based upon the silver plan. They expect 70% of Americans to choose the silver plan. The silver plan is the number that all of these things are based upon. All of these things are based upon. If you get a subsidy and you sign up for a silver plan is generally speaking going to be your best way to go. The deductibles are going to be higher, but when you qualify for cost sharing, if you go through that plan, you'll see that the deductible and the out-of-pocket actually comes down, and it'll actually be lower than some of the higher-priced plans. Okay? So if you qualify for a subsidy, a decent subsidy, I'm not talking about $10 or $12 or something like that a month. If you qualify for a subsidy, take a look at the silver plan. Don't be worried about the higher deductible and the other plans and that kind of thing, because it'll help you out in the long run. Okay? No real reason to memorize any of this. So here's how the penalty is calculated. This is where we are now. 2% of income, 325 per person. 2016, 2.5, 695 per person. Again, it's prorated, so if you have coverage for 6 months, you only pay 3 months worth of penalty. It's prorated, so you have to have credible coverage for 9 months out of the year to avoid the penalty. But if you have credible coverage for 6 months out of the year, you only pay 3 months of the penalty. Right, so you'll pay 1 month of the penalty. Now, if you fall under certain income limits, there's no penalty anyway, right? So if your income's really, really low, there's no penalty attached to it anyway. And if your income is so low that you don't file taxes, which I don't think applies to anybody here, but then there's no penalty either. We good? Any questions? I know we're kind of moving through this pretty fast. Nope. Healthcare.gov, as far as I know, is up and running. I heard stories that it was down for a couple hours the other day. It's running smoother. So what they did was to make it easier, they took out a bunch of the questions, but what they did was they wrote the questions so they're a little bit more ambiguous. So they're a little bit, the questions don't they're not as straightforward because there's less of them, if that makes any sense. Leave it to the government to simplify something and make it more complicated. We are available to help walk you through that. If you are a Medicare person, we have someone in office that handles specifically that. That's not me. I'm not even allowed to tell you that I can do it or answer questions about it, but we have someone that can answer questions. We have someone back there that recently spoke with Brian.
I want to say that Brian, who does the Medicare stuff, is absolutely wonderful, and I think he got the policy, which is considered $65.
So.
And Medicare, unlike ACA, is they do consider the existing conditions, which is very, very strict.
Medicare open enrollment is coming up. I think December 7th is the Medicare open enrollment cutoff. No, so there's never any fee. I've probably met with, I don't know, 20 people out there. There's never any fee to meet with us. If for some reason we find a solution for you, the insurance company pays us a commission. We are commission based. It doesn't cost you, the policy doesn't cost you any more to go through us. Basically, it's several hours of time to kind of walk you through and look at your situation. We've been working with Launchpad people for over 2 years. I don't know. I don't think that there's anybody in here that'll give us a bad rap or say that we're salesy or anything like that. This is not what we do. From a business perspective, getting involved with 100 some odd unemployed people is not a great business model. You know what I mean? We have other things that we work with outside to generate income. We do this, and I work with Higher Texas up in Round Rock. I just got asked to speak over at McNeil High School and that kind of thing. So there's a lot of things we do, just outreach to educate people. Because I still have people. I met with a lady yesterday who I said, "Well, you qualify for a subsidy," and she looked at me like, "What are you talking about?" I said, "Do you qualify for it based upon your income? You and your husband qualify for it." So there's people out there, that I still have people. So when do we get our free health care, right? Never. There's no such thing as free health care, right? But there's still a lot of people out there that just don't know. And navigating this, so my story, before I got into this 6 years ago, it was all the same to me. I got my health care statement and it had all these numbers on it, and I said, great, right? All I want to know is when I go to the doctor, what does it cost me, right? Because that's all that really matters, right? If I go to the doctor for flu, what does it cost? If I go to the doctor because I need a triple bypass, what's it going to cost me, right? And the bottom line, that's all that really matters. All this other stuff is just numbers and paperwork, right? That's what we do. We help you with the numbers and the paperwork so that at the end of the 2-hour session we can go, if you go to the flu, it's going to cost you this. If you have a heart attack, it's going to cost you this. And for that peace of mind, it's going to cost you this per month. Insurance is about risk. The more money you're willing to pay somebody else per month, the less risk you are taking on. What we help you do is determine how much risk you're willing to take on and how much that's worth to you. That's all insurance is about, whether it's car insurance, homeowners insurance. Other than that, it's just numbers and paperwork. Appreciate that. I don't think my 8-year-old would agree with you. We're arguing over Kindle time this morning. Don't worry about small business. This is the open enrollment numbers. February 15th is a cutoff. February 16th, you cannot get coverage.
How do prescriptions fit into this?
Prescriptions so all plans now have prescriptions, and this is delves a little deeper into how the plans are structured, right? So the government came through and said you need to include all these things in your health plan, right? And so the health insurance companies said, great, we'll include all these things. This is how we're going to structure it so we still make money, right? Government assumed that they understood how to build health plans and how to structure this better than the health insurance companies did. The health insurance companies simply took all that money, took all those numbers, gave it to their actuaries and said, how are we going to turn a profit out of this? So prescriptions work a couple of different ways, and there's a couple of speed bumps that I'll go over with you. The first one is real basic. If you switch health insurance carriers, right? If you go from Humana to United Healthcare, all health insurance carriers have contracts written with certain drug producers for which they get better pricing and this and that and the other thing. So what you may run into is, I've been taking XYZ for my high blood pressure. I switched from Humana to United Healthcare. United Healthcare comes through and goes, nah, what we really want you to take is this. Right? So you're going to run into some of that if you're taking some medications. They may switch you, they may not. A lot of things now are generics. I'm on a roll. Prescription drugs are going to be worked two ways, and this is very important when you're looking at your policy. There's a deductible and there's a prescription drug deductible. Now, before the ACA, you could have both, right? Your group company can have a prescription drug deductible and a regular deductible, right? So you would have to meet both of those depending upon where you were. Under the ACA, you can still do that, but they're called integrated, which means that anything you pay towards a prescription drug deductible goes towards your overall deductible too. However, the way that the insurance companies have structured this, on the less expensive plans, the less robust plans is the industry term. On the bronze and the silver plans, and even on some of the gold plans, there will be a care deductible and a prescription drug deductible. So you need to be very careful if you're taking certain prescriptions that you understand that even though you may have met your deductible on one end, if there's still a prescription drug deductible, you're still going to have to meet it. Now, on a lot of the plans, Humana for instance, Tier 1 and Tier 2 generics, basic stuff, amoxicillin, a lot of high blood pressure medications, certain cholesterol medications, birth control, all those things are all covered before your prescription drug deductible, okay? So my son got amoxicillin because he had a sinus infection, it was $650, even though we have a $1,500 prescription drug deductible. If you're taking Tier 3 and Tier 4 level drugs, and this is where it gets complicated, what each insurance company considers Tier 3, Tier 4, and experimental is different. So if you're taking a lot of high-end stuff or taking prescription drugs for certain things, it's very important that you read the prescription drug. There'll be a list, and I think it's 256 pages long for Humana because I looked it up yesterday, of all the drugs and what tier they are. Okay? If you're just taking basic stuff, I take a basic blood pressure medication, it's Tier 1 across the board. It's a generic, it's Tier 1 across the board. If you're taking certain things to treat specific conditions, and you're going to run into some weird things that you're like, oh, this has to be a generic. I've been taking this for years. I paid $10 for it. It may be a generic under United Healthcare. It may be Tier 3 under somebody else. It all has to do with the contract that they have written with the company until it goes full-blown, and then it's generic of everybody across the board.
When I listened to one of your earlier talks, you were suggesting that we do our research off-site, not on healthcare.gov. Are you
Yes.
recommending that?
If you're looking for something specific, if you've gone on to healthcare.gov and kind of said, okay, I have it between this Blue Cross Blue Shield plan and this Aetna plan, and you want to look up specific doctors and you want to look up specific prescriptions, I would suggest going off healthcare.gov, going directly through Blue Cross Blue Shield and directly through Aetna. I will tell you that the Blue Cross Blue Shield website is going to make you sign up. Not sign up for a plan, but then you're going to get inundated with emails. Humana, United Healthcare, they don't make you do that. You don't have to create an account to search around their site.
Is there some place to look up that, like, master list?
No, because every company's different. Be very, very careful when you're signing up for healthcare.gov. So Humana has two HMOs. They have HMOX and they have HMOX. Right? What's the difference? One's on exchange and one is off exchange. They're both called HMOX. If you're calling your doctor, you need to make very, very sure that they understand whether you're on exchange or off exchange. And they're going to tell you, oh, we don't have any way of knowing. Yes, they do. I can tell by the numbers in your membership ID whether you're on exchange or off exchange, just by looking at it. So why does this matter? This matters because I run TJ Johnson's Cardiologist. And I know that everybody that comes in for a routine whatever, it's $100. And then if they need treatment, average cost of treatment in my office is $500. And you come in and I look at your ID number and it's an on-exchange policy which tells me that you're low income, right? And you can't afford your health insurance premiums because you're on the exchange getting a subsidy. How am I guaranteed that when I hit you with that $500 out-of-pocket bill that you're going to pay it? Right? So a lot of private practices are opting out not to take insurance off the exchange. That's just business economics. It's just the way it is. When you call, and you call TJ Johnson's Cardiologist, you want to get to the insurance person. Who can I speak to in your office that handles insurance and insurance claims? You don't want to talk to a nurse. You don't want to talk to whoever that answers at the front desk. What you're going to get is, oh, I do that. What's your question? My question is, I'm signing up for Humana HMOX on exchange. I want to know if you guys are in network. Oh, absolutely. We take all Humana insurance. You take all Humana insurance. Yes, I'm pretty sure we're in the Humana network. You're pretty sure you're in the Humana on exchange HMO network? Or you're pretty sure that you take Humana insurance? I don't know. What I suggest you do is you contact Humana. Right? It's the Stonewall. They don't know. The answer is, I contacted Humana. They told me to talk to you because I needed to talk to the doctor's offices specifically. I'm calling all of my doctors to verify that they take this insurance. Because Humana is going to tell you, oh yeah, they're in our network. Why don't you give them a call to verify? Okay? So there's some legwork. If, for instance, you don't care, my whole family goes to Austin Regional Clinic. The default hospital for Austin Regional Clinic is Seton. Okay? That's where they're automatically going to send you. Austin Regional Clinic takes any insurance known to man. I can get Kathy Lansford-Powell health insurance and they'll take it. Where you're going to run into issue is small private practice, right? No, my doctor's not private practice. There's 3 or 4 other doctors in his office. No, 3 or 4 other doctors share an office with your doctor. If it is not an Austin Regional Clinic, Seton, St. David's, if you don't go to a giant, expensive, multi-storied building to see your doctor, he is in private practice. I don't care if it's Far West Medical. That's private practice. Austin Cardiological is a private practice. Okay? Austin Oncology, private practice. So don't think just because they have a cool name and it says Austin in it that they're public coverage. They're not. You need to verify all of this. All the stuff that you hear about people, I was on a network, I was on a network, I was on a network. The onus is on the consumer now. That's just the way it is.
Whether you're on bronze, silver, whatever, will the drug coverage be the same?
No. The same drugs will be covered. The level to which those drugs will be covered is different. She had asked, if you sign up for United Healthcare plan, and the difference between the plans, bronze, silver, gold, and platinum, is the prescription drug coverage the same? The same drugs are covered, but the level of coverage is not the same.
But you don't have to worry about, say, your blood pressure medicine being covered on gold or not silver.
Correct. The copay will be lower on the gold plan, though, than on the bronze plan. Be very careful on the bronze plans. There are certain bronze plans out. I pick on Humana. I really like Humana. I've done a lot of business with them, but I know their plans inside and out. On the Humana, the lowest option, the least robust bronze plan is not a copay plan. You'll find this with a lot of the group plans now. You go and you pay the doctor whatever it is the doctor tells you that you owe it. It's a non-copay plan. Until you meet your deductible, the insurance company doesn't pay anything. You still get the discounted price, whatever the negotiated rate is, but you still have to pay out of pocket. Another quick thing I want to touch on real quick, because I get this question a lot, especially for you guys rolling out a group. Your dental and your vision insurance does not have to be tied to your health insurance. You can get dental and vision insurance anytime you want, anytime throughout the year. There's no open enrollment period. You don't have to stick with a certain carrier. It doesn't matter. A lot of times with dental insurance, you need to be careful though, because and same thing with vision, there's an elimination period that you have to meet before you can get coverage. For a lot of you that have the COBRA option, and a lot of you don't know this, you can keep your vision and your dental insurance on your COBRA and cancel your health insurance, which means you've met your exclusionary period on your dental and your vision, so you can go get work done right away, but you don't have to pay the high price of the medical on the COBRA. Because the insurance for your dental and vision once you're on COBRA doesn't change very much from what you were paying in the original. It's the health insurance that blows up on you, right? A lot of you rolling out of Dell, AMD, IBM. The company subsidizes your COBRA for usually the first 90 days, right? So you roll out and you go, oh no, that's not so bad. It's exactly what I was paying before. 90 days, 180 days from now, it blows up to $1,200, $1,300, $1,400 a month. Why did that happen? They're not subsidizing it anymore. You need to be very, 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 very careful. I can't stress this enough. If you sign up for COBRA, you send that paperwork in January, say, yes, I want COBRA. January 1, you say, yes, I want COBRA. March 31st rolls around, out of your 90 days of your severance package, and that premium blows up on you. You are outside of open enrollment. You cannot sign up and get a subsidy. You cannot sign up for health care. You're stuck with that COBRA until open enrollment runs around again. Be very, very careful with that. They had a one-time exception last year, ran until July 7th, because people were caught in that trap. It's particularly important for those of you rolling out because they subsidize it, so it looks very, very low. They will not tell you. Dell is not going to sit down and go, oh, by the way, in 90 days your COBRA payment's going to blow up on you. The people that I've counseled in here had no idea that Dell was even subsidizing it. Until I got the bill, I said, no, in 60 days, this is what it's going to be. You need to, if you have questions, you need to call HR and ask them that specific question. Is my COBRA being subsidized for a certain amount of time? The other thing about COBRA, people like to play that game. Oh, well, what I'll do is I'll just run it out 75 days, and if anything happens, I'll sign up for it then, because you have that 90-day window to sign up for it, right? You will pay all the back premiums. That's the way COBRA works. You will pay the back premiums to the day you got laid off. So if you run it out 89 days and break your arm and go, oh man, I got coverage, great, I'll just sign up for COBRA now, you will pay the last 3 months worth of COBRA premium in order to get your policy caught up to date. Just so you know, to be very, very careful, especially when you're rolling out of the tech industry with that COBRA payment. No, dental vision insurance doesn't matter. That's if you want it. You don't have to keep it. You can if you don't want it.
So if you roll up a job in May, you can still sign up through your channel?
Yes. Any the reason that COBRA, if you cancel your COBRA because it's too expensive, that's considered a voluntary termination of coverage, which does not qualify you for an SEP, a special enrollment period. Involuntary loss of coverage, your plan got canceled, your company went out of business, you got terminated, anything like that, that counts as qualification for an SEP. 60 days. You have 60 days before now. You want the real numbers? If you go through the exchange, if you go through healthcare.gov, you have 60 days before the event and 60 days after the event to qualify for a special enrollment period, right? So if you happen to know you're going to get divorced in 60 days, you can sign up for healthcare.gov. Through healthcare.gov is a special enrollment period. If you go private, you have 30 days before the event and 60 days after the event. Don't ask me why, that's the numbers.
I know AC Mola goes widespread in New York and Maine and Connecticut, and they get some claims they go bankrupt. What happens?
They go bankrupt. I mean, the 2008 financial crisis came. Lehman Brothers went bankrupt. You know.
Blue Cross has a lot of coverage on these gold, silver, bronze.
Yeah. When the hurricane hit, what was it, 12 years ago in Florida, and Allstate and State Farm pulled up and left. They pulled up and left. Allstate and State Farm came through and said, we're no longer going to issue hurricane flood insurance in the state of Florida. The state of Florida department said, you either offer all your lines or you offer no lines. And so State Farm and Allstate said, we're out of here.
Can you tell them how to reach you?
Yes.
Contact information and then
Maybe. So my cards are on the back, little blue cards, cool looking. My email, there was a slide up here, I don't know what happened. There was a slide up there with my contact information. My email is T as in Thomas, J as in Johnson. Last name Johnson, Johnsson, so yes, it's 2 J's, TJ Johnson, at C as in cat, the number 4, B as in boy, G as in good, C4BG.com. My cards are also in the back, blue cards. I have some extra cards in my pocket, not a whole lot. I'll put these Humana flyers back there. It's not an endorsement for Humana. It simply has the income chart in it if you want a copy of it to take home. Any other questions real quick? Oh, okay. Good.